Hello, my name is Ricardo COF, and for what I'm talking about today is the existence of medically assisted suicide and its benefits towards terminally ill. There are two main points that I was researching that found out that came up consistently. One was that physician-assisted suicide allows patients to be relieved of pain. By just a chance, does anyone here have or know someone who has died of a terminal illness or a disease? Can you please raise your hand? So, thank you. For my first point, it's for there was a research study by the Warren G. Mangus Clinical Center of National Institute of Health, and they did a study that ran over had 992 terminally ill participants. Within that, half of the participants felt either moderate or severe pain throughout their whole time through the study. While with that, they also were able to see where the range would be. One benefit is to end the pain. Most people suffer through it and suffer through it alone sometimes, and giving them that outlet, knowing that the pain will end, sadly also ending their life, will reveal and give them either peace or just relief. With that, the second point I want to keep up is it gives patients time with their family and to stop overthinking of like, when will I get healed, and let them just enjoy the memories and acknowledge what they have with their family. With that, they also give them gives them closure as well for the family. When most parents pass away from either children or some aspect like that, people get very hurt and are looking for one thing, more importantly, looking for closure. In a study, and the Health Director of Australia, they're reading through a study and saying all people who have long-term illnesses, they tend to want one thing, and it's family. So with having a physician-assisted suicide, it gives them that aspect and gives them the time to be with them. Keeping patients who are terminally ill and fighting a losing battle with a disease is also very costly. It is about on the upper scale of $10,000. $10,000 every day, according to 60 Minutes news correspondent Steve Korf, that's his name correctly. When he did his study, he was realizing it can cost up to $10,000, which most families cannot pay every day. And which also leads to my second point, where physician-assisted suicide actually will relieve hospitals and medical staff, and instead of caring for a patient who may not have a tomorrow or a day after, gives the staff time to work on patients who need assistance currently. Referring back to the $10,000, instead of having a patient family pay for the $10,000, the staff and the hospital can use.
I have no idea what that noise is. Pay no attention to it.
Oh, okay. I was like, damn it, right into that. So with the $10,000, that money can be used for someone who is currently in the emergency room, and instead of paying for an intensive care unit. Also it gives time for the hospital to also appreciate whoever is in the terminally ill position. It's commonly known that nurses also get very attached to their patients, especially if they know them or they feel connected to them in some sort of way. So to close off my argument is that physician-assisted suicide or medically assisted suicide is a beneficial factor for hospitals and for patients today. Thank you.
All right, Ricardo, the topic is fairly controversial, but I'm not sure that you've explained what the argument, the controversy is. Obviously, a lot of patients who are in terminal stages have pain and suffering, and my question is, and why do they have that? Are they not being treated correctly? Do they not get the pain relief that they're entitled to? Is it not possible for them to take as much, painkillers as would be required in order to stop the pain and suffering that they're going through? Because that seems to be the main justification that you have here for that. The implication that it costs $10,000 a day, that certainly applies to some forms of treatment that are going on, but I don't know how many people represent this kind of a daily investment at the end of life. There's not a discussion of what the circumstances are under which most people die. If most people die in hospitals and they die paying $10,000 a day at the end, there should be some data that suggests that that's true, and you should be citing that information. Some of the problems start at the very beginning of the speech. I know what the subject area is, but it's phrased as an informative speech. There's not really a declarative sentence that gives us the proposition. There's not a layout of what the supporting structure is going to be for the argument, and I think that that's problematic. The benefits that you talk about seem to be about pain and suffering, and also about saving money. So those are the two subjects. I can tell that those are the secondary points, but they need to be labeled more clearly in the preview of the argument. And then I think you sometimes bounce back and forth between those issues once we get to those points. I did think that you had some good information that talked about the frequency with which people who are in terminal stages have pain and suffering. I thought that was good information. There was a study that talked about how important it was for people to have family, and that's not a bad thing. My question is, why is family denied to people because they have terminal illnesses? How does physician-assisted suicide give them a family? That's not explained. The way in which that information is being put together needs to be clarified to some degree. Like I've already mentioned on the cost issue, I think there's some problems here with the way it's been presented, that there are some costs that go along with this, I don't doubt. The idea that physician-assisted suicide is going to result in some benefit to the family, I think there are some potential problems that are going on there, but that doesn't really seem to be significant as in regard to the way you're going on this. It just, it's a tangential argument that you are developing here that I don't think really builds very far when it comes to the economics on this. At the end of the speech, there is a clearer statement of what the proposition is. It does still have multiple parts in it, but at least I knew ultimately what it was that you were trying to remind us of at the end, and I thought that does help you quite a bit. All right, thank you.